Dr. Jeff here with you again this week with Co-op Student Colin. Hope everybody had a great weekend, and thanks everybody for your comments on our topic last week on scoliosis. That was great. What are you going to talk about this week, Colin?
So this week we're going to talk about ankle sprains, and we're going to talk about two of the types, inversion and eversion sprains. So eversion sprains is when your ankle falls in and you damage the inside of your ankle, and inversion sprains is when you go the other way and damage the outside of your ankle. And ankle injuries are the second most leading cause of sports injuries.
So what happens with your ankle? So here's your foot. In your ankle here, on your foot here, you've got the big tibia, you've got the small fibula on the outside bone here, you've got this talus bone that it sits on, and then you have the calcaneus, which is the bone on the bottom. In your ankle, you've got three ligaments, small ligaments on the outside of the ankle. You've got the one at the front, you got one in the middle, and you got one at the back. On the inside, you've got one big ligament. It's actually a bunch of ligaments that kind of knitted together to cause, we call it deltoid ligament. So you can see this joint is a lot bigger. The ligament is a lot tighter, so it's much more difficult to kind of roll your foot in that way. That's why inversion sprains can go this way. It makes up about 85 to 90% of the ankle sprains that we see. And there's generally 3 degrees of ankle sprains. First degree, when you do an eversion sprain, generally you have a bit of a plantar flexion with it, so it goes like that. So this front ligament is going to be the first one to feel it. Second will be the middle, third will be the back. Generally with an ankle sprain, you get what we call a first degree sprain, and that's just when the ligaments kind of get stretched. It's kind of like, oh, you felt it and you start to walk it off. And you walk it off, the next day it's a little sore, but you go back to playing your sport. A second degree is where there's micro tears in that ligament. So you go a little too far, you get some tears. It's not completely ruptured, just kind of torn. We call it a second degree sprain. Generally with treatment, we can kind of get you back in your sport within 2 to 4 weeks with some treatment here. If it's a third degree, that's where generally it ruptures. And rupture is not good. That generally requires surgery. Sometimes the surgeons, depending on your age, will say forget it and just brace it up and continue your sport with a brace on it. You have this bone here called the talus bone. It kind of sits right here, and this tibia sits on top of it. And what happens when you roll your ankle, that talus is going to shift to that side, and before any ligament is going to tear or anything, that talus is going to shift to prevent that from happening. But the problem is that talus shifts, and now we can't get that talus back. And people will complain about having chronic ankle sprains or weak ankles. Well, it's generally because they never got that talus adjusted back to where it's supposed to be. And what happens is now they're kind of sitting halfway out because that talus is sitting off to the side a little bit. So it's very important, as Colin's going to talk about, to get that realignment as soon as possible.
So right after you get an ankle injury, you want to sort of flush the swelling out right away and reduce that inflammation. So what we do is generally follow a rule called RICE. R, rest it, so you don't want to be on it too much. I, ice, so ice helps reduce your swelling. C, being compression, so if you compress it, again, it will help with the swelling. And E, elevation, again, trying to get all that swelling out. And what we can do is we can actually go in and provide you with some laser therapy and a swelling setting on IFC, which will help, again, pump that swelling out of that ankle. And once the swelling's out, then what Dr. Jeff was talking about is then you can go in and actually adjust the talus. Right after that, maybe a couple days later, we're going to try and get some motion and some movement into that ankle. And that, again, will help with the swelling. So maybe we'll do a little bit of balance exercise, some movement, maybe with a band, drawing letters with your toes. And again, that will help sort of push that swelling out and get some movement going on in that ankle. And then maybe a week later, we're going to look at maybe strengthening that ankle. So doing exercises, strengthening this muscle over here, which will help with the ankle sprains. And from there on, depending on where you are, we'll do some more sport-specific exercises, so maybe some cutting, some jumping, some quick stop and goes, and try and get that ankle back to where you were before your injury.
So as far as prevention is concerned, we want to keep it from getting hurt again. Now, Colin talked about immobilization a little bit at the beginning. There's research out there whether, I've seen people coming in with a boot. Usually a physiotherapist kind of recommends a boot to put on, or just a brace, or even getting it taped. The research for a boot versus a brace is pretty well similar. There's no real better way of doing it. So you just want to get a brace because you want to keep the motion going this way, but we don't want this going this way. Research has shown that someone who sprains their ankle, 75% of them will re-sprain their ankle within the next 6 to 12 months. So you really want to prevent another injury. So wearing a brace is very important. So once we start to, once we get the swelling out, we can get a brace on that to try and prevent you from injuring it again. Taping is okay, but taping on your own is not very good. You need someone who tapes a lot because you can really screw the taping up. You can cut off your blood supply. You can give yourself lots of different issues with improper taping. But even when you're done all the therapy and we get you back in your sport, most of my high school athletes and my university athletes that play basketball or volleyball or football or anything that can lead to this injury, I usually recommend even when they're playing the sport, they continue wearing a brace. Or they get a brace now and put it on. Because the whole idea, we want to prevent that from happening. Because the more times you sprain your ankle, the more damage that can be done. And again, a lot of people complain about after this having weak ankles, and I'm always going over on it. It feels weak. Well, that's usually because they didn't get their tails adjusted, which is very important. I've had athletes that come in sprained ankles, and back in the day, when I was doing a lot of basketball teams, and I could get them back on the floor within a couple weeks if I get that tails adjusted versus athletes that went to physio and didn't get it done were 3 to 4 months. So it's very important to get that done. Also, again, we want to get that braced, and we want to keep that braced. We don't want you to have that injury happen again.
So if you liked the video today, make sure to leave a big thumbs up. Make sure to follow us on YouTube, Facebook, and Instagram. And if you have any questions about what we talked about today, or maybe you want to share a story about your own ankle injury, feel free to email us. Email us at jgoldsworthy@goldsworthywellness.com. And as always, here at Goldsworthy Wellness, we got your back.